All right, today we're going to talk about one of the most incredible stories ever told. It's the story of birth. We're going to frame this whole thing as an epic journey, and we'll look at the amazing technology that helps guide and protect a new life as it makes its way into the world.
I mean, really think about that for a second. It's a question that connects every single one of us. It's a quest that involves biology, incredible endurance, and, a whole lot of science. So let's dive right in. What does it really take?
Because at the end of the day, it all comes down to this, a profoundly human experience, supported by this whole arsenal of amazing technology. This moment right here is the destination, and today we're going to chart the map that gets us there.
Every great adventure has a beginning, right? A sign that things are about to kick off. For pregnancy, that first step is all about confirming the journey has actually started, and then getting the very first maps of this unseen world inside. And this is basically the first signpost on the path. A simple home pregnancy test is designed to look for a very specific hormone called human chorionic gonadotropin, or HCG for short. This hormone only shows up after a fertilized egg has attached to the uterine wall. It's basically the body's way of announcing, okay, the journey's officially begun.
Of course, no hero goes on a quest all alone. And that's where maternity care comes in. Think of it like a fellowship of guides and guardians. All the doctors, the nurses, the midwives, the specialists, who are there to provide support and expertise every single step of the way, from that very first test to the days after the baby is born.
So, how do we get our first peek into this hidden world? Well, we have two amazing tools that give us our first map. On one hand, you have the ultrasound, which uses sound waves to create an actual picture of the fetus. And then you have the fetal Doppler, which also uses sound waves, but its job is to let us hear the baby's heartbeat. That is the first incredible rhythm of a new life.
Okay, so as the journey moves along, the destination starts to come into view, and preparation is everything. The modern delivery room is this carefully designed space, kind of like a chamber of birth, and it's packed with specialized tools to support the final stages of the quest.
And right at the center of this chamber, you'll find the modern birthing bed. And let me tell you, this thing is a perfect example of how far we've come. This is not just a place to lie down, no way. It's an incredibly advanced, totally adaptable piece of equipment built to help the mother in a bunch of different ways.
And this versatility is absolutely crucial. The bed can be changed up to support sitting, leaning over, squatting, or even a hands and knees position. It's all about allowing the mother to find whatever posture is the most comfortable and the most effective for her while she's in labor.
So while the bed is giving all that physical support, this machine is telling the story of what's happening on the inside. It's a cardiotocography machine, or CTG. It uses two simple sensors on the outside of the belly to track both the baby's heart rate and the mother's contractions. This gives the medical team a live play-by-play of how labor is going, helping them see if the baby is getting stressed out or not coping well.
And now we're here. This is the climax of the whole journey, the final challenge, the delivery itself. This is the moment everything has been building towards, and, as it turns out, there are a few different paths it can take.
So, you've got two main routes to the finish line. The most common is a vaginal delivery, which is the natural physiological process of the baby traveling through the birth canal. The other route is a lower segment cesarean section, an LSCS, which is a surgical procedure that's used when a vaginal birth just isn't safe or possible. It can be planned ahead of time or happen in an emergency.
But, sometimes, even on the most common path, things can get a little tricky. A little extra help might be needed to navigate a tough spot. So what happens then? What happens when the journey needs a helping hand?
Well, this is one of the tools that can provide that helping hand. It's called a ventouse, or you might know it as a vacuum extractor. It's a modern device designed to give some gentle assistance if labor stalls, or if the baby just needs to be delivered a little more quickly.
Now, this whole procedure is very, very controlled. A soft little suction cup is placed on a very specific spot on the baby's head. Then, some gentle suction creates a secure hold. Then, during a contraction, while the mother is pushing, the doctor just uses the device to help guide the baby's head through the birth canal. As soon as the head is delivered, the cup comes off, and that's it. The final challenge is complete.
So with that final challenge met, the hero arrives. And those first few moments of a newborn's life are so important. A whole new set of tools comes into play to make sure that the welcome to this world is safe and warm.
One of the very first things that happens involves this simple but totally essential tool, the umbilical cord clamp. It might not look like much, but it's placed on the cord to stop the blood flow from the placenta, and it marks the baby's official physical separation from mom. It's a huge moment.
You know, right after birth, a newborn can lose body heat incredibly fast. That's where the radiant warmer comes in. It's designed to provide this gentle, overhead heat to keep the baby's body temperature stable as they get used to life on the outside. It's really their first warm, protective embrace in this new world.
But the journey isn't quite over just yet. For some newborns who need a little extra support, the quest continues for a few more days in a very special, protective sanctuary designed to nurture them.
And this is that sanctuary, the infant incubator. It's so much more than just a clear box. It's basically a self-contained life support system. It creates this perfect, controlled environment for infants who are premature or sick, giving them the intensive care they need to thrive.
And inside this little sanctuary, every single thing is controlled. You've got panels to manage the heat and the humidity, special ports for IV lines and feeding tubes, even built-in lights for treatments, all of it visible through that clear hood. It is, for all intents and purposes, a high-tech womb. And for a really common issue like newborn jaundice, that's when a baby's skin gets a bit yellow from too much bilirubin, there are even more specialized tools. This is a Billy blanket. How cool is this? It's a portable little blanket that uses fiber optics to shine blue light onto the baby's skin. And that light literally helps break down the bilirubin. It's a blanket of light that helps them heal.
So wow, from that very first hormonal signal all the way to that first warm embrace, we've just traveled through the entire world of modern maternity care. It's a world where all this incredible technology really only serves one purpose: to support this fundamental, powerful human bond.
And I guess that leaves us with one final thing to think about. As these tools get even smarter, even more advanced, how is this amazing blend of high-end technology and profound humanity going to keep shaping the epic story of how every single one of us begins our own journey?